Hello, everyone, and welcome to third quarter CE for 2025. Today, we are going to review triage to alternate destination. In this CE, we are going to review mental health holds, transporting patients on a hold, a review of CCMSA's Destination Policy 547, and we are also going to touch on a new facility that is available in Madera, River Vista. Let's begin with psychiatric holds. These include 5150s, extended 5150s per AB 2275, a 5250, and LPS conservatorships. LPS conservatorship is valid for 1 year and can dictate where the patient lives, receives treatment, and what medications they take. What is a 5150? A 5150 is an application for assessment, evaluation, and crisis intervention or placement for evaluation and treatment. It is a 72-hour hold that is based on imminent danger to self, to others, or gravely disabled as a result of a mental disorder. Our role as EMS providers is to transport the patient safely from the scene to CSC, River Vista, or an emergency department if appropriate. Always verify the completeness and status of a hold. A 5250 is a 14-day hold. Here is an example of the State of California application for a 5150 hold. As EMS providers, we need to ensure the completeness of this hold before departure, including the name of the patient, their date of birth, and known residence. In this section will be a detailed description as to why the patient is being placed on a hold. We also need to ensure that at least one of the 3 criteria have been selected. And we also need to ensure that the name of the person who wrote the hold is legible and signed, along with the date and time that the hold was placed. As a note, a copy of the original 5150 will be sufficient for EMS providers who are transporting patients on a hold. AB 2275 aims to end the repeated use of 5150s in emergency departments by requiring a review hearing before an extended hold expires. In Fresno County, this form must be included in the transfer packet, or crews must have a printed progress note confirming the hearing and its outcome. Per American Ambulance Policy, all patients on psychiatric hold shall be restrained. This includes pre-hospital, interfacility, and LDTs. This is regardless of age, with a minimum of 2-point restraints required, 4-point at crew discretion. Make sure to restrain on scene with the assistance of law enforcement. And remember to be respectful and mindful of the patient with their dignity and privacy. Uncooperative patients. If your patient is not on a hold, they cannot be placed in restraints unless the patient agrees or gives consent. If the patient is on a hold and is uncooperative or aggressive with the restraint process and law enforcement is on scene, disengage and request law enforcement assistance with restraints. If law enforcement will not assist, call the field supervisor. We will not restrain or transport unrestrained patients who pose a potential threat to providers. For uncooperative patients where law enforcement is not on scene, disengage and request law enforcement response. Should they not respond, contact the field supervisor. Again, we will not restrain or transport unrestrained patients who pose a potential threat to providers. Let's quickly review LDTs and restraints. As best practice, encourage the patient to use the restroom prior to departure. Restrain the patient prior to departure with the assistance from staff from the sending facility. Restraints are never removed until they are removed by the receiving facility. Ask the sending facility when the patient's last dose of medication was given and if one could be given prior to departure. Once the patient is restrained, they stay restrained for the duration of the transport and turnover. If your patient slips the restraints, crew safety comes first. Determine if the patient is threatening to fight or flight. Declare crew emergency if appropriate. Calmly tell the patient that we will pull over and let them out of the ambulance if they wish. In this scenario, notify dispatch and give the patient description and the direction of travel. Now we are going to review CCMSA Policy 547, Patient Destination. This policy ensures the patient goes to the right place the first time. It reduces the impact in the emergency departments. It also includes triage to alternate destination. In Fresno County, we have CSC and CSU for our default destinations, and Madera County now has River Vista. For 5150 patients in Madera County, their destinations include River Vista or Madera Community Hospital for adults, and pediatric 5150s will go to Valley Children's Hospital. Fresno and Madera County 5150 holds consideration. If the patient meets the following criteria, he or she shall be transported directly to CSC or River Vista if they are 18 or greater, or the Youth Crisis Stabilization Unit if they are under 18 years of age. No urgent medical complaint or evidence of acute medical, surgical, trauma problem requiring urgent treatment prior to psychotic admission. No alteration in mental status due to dementia or delirium. A GCS score of 14 or 15. Complete vital signs within normal limits, including heart rate, respiratory rate, blood pressure, and GCS. Not febrile to palpation or measurement. Under the influence of alcohol or drugs, patients can walk without assistance and is able to follow verbal commands. This does not apply to YCSU. For adults, the vital sign ranges are a heart rate of 50 to 120 beats per minute, a systolic blood pressure of 100 to 180, a diastolic blood pressure of less than 120, and a respiratory rate between 12 to 30 per minute. For pediatrics, the vital signs should be appropriate for age listed under Policy 530.32. Here is the CCEMSA screening form to help determine which patients meet the criteria for triage to alternate destination. Be able to find a copy of this screening form in ImageTrend under Worksheets listed as alternate. As a reminder, CSC, CSU, or River Vista cannot accept the following patients: patients with dementia or delirium, patients with ongoing medical care, including patients who require continuous oxygen use, catheters, wired devices, etc., patients in wheelchairs that cannot move independently, and patients with any open wound, laceration, skin ulcer, or decubitus that requires anything more than once daily dry gauze and tape dressing. When transporting a patient to an alternate destination and they are on diversion, the destination screen in ImageTrend, under the destination reason, select diversion. If you are transporting a patient to an alternate destination and the patient is refused by staff, under the destination reason, select CSC patient refusal. You are then going to be asked to give a CSC refusal reason, and in this box, provide a quick description as to why the patient was refused. If possible, attempt to get the staff member's name who's refusing the patient.